My presentation this morning is on health challenges posed by climate change in the Pacific. Okay, the outline of my presentation. First, I'll just give some general characteristics of Pacific Island countries. I think it's important to understand, these general characteristics, as we relate to climate change. Also, we'll also be talking about some of the health challenges that's been posed by climate change as we get to know over the years from work that's been done in the Pacific, and other challenges that we continue to face. These may not be strictly health challenges, but it's challenges from that also exacerbate the issues of health and climate change. Okay, so maybe just again a quick look at the Pacific again. The Pacific island countries, are represented by or broken up into three regions: the Melanesia region, Micronesia, and Polynesia. So we have Micronesia up in the north, Polynesia southwest and southeast, and Melanesia located in the southwest. Okay, Pacific Island countries, as some of you have mentioned, they're very small countries, small territories. Many of them, and they're also, spread out, in a vast ocean area of the Pacific. They're distant from one another, as well as the major countries like Australia, New Zealand, or US. Some of the islands, or here, before we go, so you can see, the Pacific in proximity to, the United States, Australia, or Asia. So these are, some of what the islands look like. I trust, most of you have been to some of these islands, but in case some of you have not, the picture on the top left, this is an example of a small atoll island. Some are, low-lying atoll. Some are low, but they're longer in length. Some are, wider, like the picture at the bottom, and some are, quite mountainous and volcanic origin, like the picture on the top right. Again, the livelihood of Pacific Islanders, really depend on resources from the sea and land. So we depend very much on fish and seafood, and also, food from the land, the root crops, fruits and vegetables, fresh water. And what you see in this picture are food crops like taro, banana, pandanus, and many others. Over the years, we develop a taste for imported processed food, but again, I list imported processed food here because when we talk about food security, imported food is one of our main sources of food security. Okay, so just a bit of background on climate change and health in the Pacific. Our very first workshop that we can remember in the Pacific, our meeting, was on climate variability and change in Samoa back in 2000. And since then, not much action happened until in 2009 when our health ministers met in Madang, PNG. And one of the issues that they considered during that meeting is climate change and health. they do recognize that Pacific Island countries were vulnerable to climate change, and they identify several high priority climate sensitive health risks common throughout the region, and some of these included vector-borne diseases, waterborne diseases including water security, foodborne diseases, food security, injuries and deaths from extreme weather events, compromised food security and malnutrition, and mental impacts of loss of livelihoods and climate change-induced population displacements. So during the same meeting, the health ministers were committed to take action on climate change, and also they recommended some activities for each of the Pacific Island countries to undertake, and these include to plan and implement studies on health vulnerability assessment due to climate change, develop national strategies and action plans, increase awareness among policy and decision makers about the impacts of climate change on health, mobilize communities to better adapt to health consequences of climate change, and strengthen national capacity to develop and implement effective interventions to minimize climate-related health risks. And so the recommendation for the health vulnerability assessment was actually carried out in 12 Pacific Island countries between 2010 and 2012. This study was also resulted in these Pacific Island countries developing their national climate change and health action plans. So the highest priority climate sensitive health risk in Pacific Island countries that came out from the assessment include trauma from extreme weather events, heat-related illnesses, compromised safety and security of water and food, vector-borne diseases, zoonoses, respiratory illnesses, psychosocial ill health, non-communicable diseases, population pressures, and health system deficiencies. Some of the likely effects of climate change on key specific health issues include respiratory infections, skin diseases, poverty, socioeconomic advantages, traumatic injuries and deaths, typhoid, ciguatera fish poisoning, histamine poisoning, eye disease, filariasis, and malaria. So I will not try to be very specific on the climate sensitive health issues in Pacific Island countries. I hope that the later presentation by some of our Pacific Island countries, they will share more specific experience on climate change and health. But these are the main health issues that were identified by the 12 countries that did their health vulnerability assessment. For example, Cook Islands, their main priority area for health and climate change is to address dengue fever and diarrheal disease, FSM, waterborne, mosquito-borne disease, including malnutrition, Fiji, dengue fever, typhoid fever, leptospirosis and diarrheal disease, Kiribati, food and water and vector-borne diseases and security. Nauru, they identify air quality, food security, and NCDs as their priority. And Niue, vector-borne diseases, ciguatera, diarrheal disease, respiratory disease, heat-related illness, NCDs, trauma from extreme weather events. Palau, they identify vector-borne diseases, zoonotic infections, gastroenteritis, respiratory disease, NCDs, trauma from extreme weather events, mental health issues. Marshall Islands, they also identify food and water vector-borne diseases, including respiratory disease and malnutrition. Solomon Islands, vector-borne diseases, respiratory diseases. Tonga, diarrheal disease, vector-borne disease, food security, and so on. Tuvalu, diarrheal disease, respiratory disease, food security, NCDs, and Vanuatu, food and waterborne disease. So you can see that a lot of these are very much common for the Pacific Island countries. Here, this is a map that our Pacific Public Health Surveillance Network would distribute to Pacific Island countries pretty much on a weekly basis, kind of giving you a picture of disease, outbreaks that's been happening in the region. And from here you can see that one of the main disease outbreaks that we often see here are really the vector-borne diseases. Zika, you can see dengue here, dengue 2, 3, dengue here, and also over here in these three countries here. We have Zika here, we have chikungunya, so it also shows, as somebody mentioned earlier, the frequency of outbreaks of mosquito-borne diseases is increasing in the Pacific Island countries. Okay, some of the other challenges, health challenges that we face, these are not new challenges, but we understand they also contribute to the climate change and health issue. Again, this like ongoing shortage of human resources for health, incomplete or limited health data, information systems. In the case of Aspen, when we did our health vulnerability assessment, one of the things that we realized was that we have very complete weather data going back about 50, 60 years, whereas health, we were only able to look at data between 2000 and 2010. So our analysis was not that good because we only look at compare weather and health data for 1 decade only. So I think that's an important area that also needs to be improved in order for us to continue to study the correlation between climate change and health. Also, in the Pacific, we have small populations, but spread over many islands, over vast area, and it also poses a challenge to the health sector. Again, I think we all know that in the Pacific, burden of NCD is one of the highest. In FSM, for example, I think the leading cause of morbidity or hospital admissions is NCDs, diabetes, heart disease, etc. Also, finance and resources are limited. Therefore, it's always difficult to improve our health challenges. And as we talked about, some of us talked about territories, their situation, it's also difficult for them to also seek funding sources from donors because of their affiliation or because they're territories of the developed countries. So I hope we can also find ways where, especially those countries that want to, come together with some of the territories to to develop like funding proposals, to seek funding that we can find a way to include some of those. Well, like in Micronesia, we have our Northern Pacific Environmental Health Association, and we've been trying to find a way to include like Guam and CNMI in our project proposal preparation, but we understand it's also going to be difficult because of their affiliate or being a territory of the U.S. So I hope this is one of the issues that we can also address in this meeting and find ways to address them. The other health challenges, just I think our most vulnerable population are really those that are living on low-lying outer islands. I mean, the fact that they're so low, it makes them vulnerable to cyclones, floods, storm surges, sea level rise, and disturbances in water supply caused by drought or salination of aquifers. Vulnerability, we have a lot of dispensaries or small health facilities in these outer islands, so they're also very vulnerable. Also, we have limited awareness of the health risk of climate variability and change in the islands. Again, as mentioned, insufficient data and monitoring of climate-sensitive health impacts and risk. I think John also mentioned insufficient integration of climate and disaster risk into health sector policy. So we've seen this already happening in the climate change and disaster sectors, but health has yet to also come in. Also, sometimes there's poor coordination across ministries and departments on the health risks of climate change. And one of the main issues in some of our Pacific Island countries is limited transportation, and which health services is very much dependent upon, especially for outer island populations and small remote parts of our region. I think, yes, this is all I have. And thank you very much.